Doctors don't always warn you about this, but if you're over 50, these common drugs could be stealing your memory. Have you ever wondered if the prescription medications you're taking could be silently undermining not only your physical health but also your memory and cognitive abilities? It may be surprising, but emerging scientific research shows that certain widely used drugs, especially when used without careful oversight, can actually accelerate or contribute to memory loss and cognitive decline. What if you had the knowledge to identify these medications and take action to avoid or reduce your exposure to them? The impact on your overall quality of life could be profound. For many years, we've accepted memory deterioration and cognitive dysfunction as an unavoidable part of aging. However, recent breakthroughs in neurology suggest otherwise. Memory loss isn't something we're destined to suffer simply because we grow older. Instead, specific medications and other risk factors are now understood to play a substantial role in cognitive impairment. Learning to distinguish between conditions caused by age and those triggered or worsened by drugs is essential. With the right awareness, you can manage health conditions without sacrificing mental clarity. Notably, medications such as proton pump inhibitors, PPIs, like omeprazole and various anticholinergics, prescribed for everything from acid reflux and ulcers to Parkinson's disease and bladder issues, have now been linked through observational studies to significantly elevated risks of dementia. Yet how many people are truly aware of these potential side effects? Many patients self-medicate or continue long-term usage without realizing the cognitive price they may be paying. Stay tuned all the way through because medication number 7 on our list is particularly alarming, and one that most people likely haven't heard about. For those interested, we've provided full references and scientific sources in the video description, so you can dig deeper into the evidence. For a long time, it was widely believed that dementia and milder forms of cognitive impairment were simply unstoppable consequences of advancing age. But due to extensive new research, we've learned that dementia, especially Alzheimer's disease, is driven by specific underlying conditions and pathological processes in the brain, rather than age alone. When scientists analyze post-mortem brains of elderly individuals with dementia, they consistently find telltale abnormalities like beta-amyloid plaques and tau tangles, abnormal proteins that disrupt neuron function. Genetics certainly matter. Some individuals are more predisposed to developing dementia. But environmental factors, lifestyle choices, cardiovascular health, and medication use all interact to determine actual cognitive outcomes over decades. Encouragingly, evidence suggests that it isn't just about preventing decline. It's possible to maintain and even enhance cognitive performance with good habits. Regular physical exercise, a balanced diet rich in essential nutrients, ongoing mental and social engagement, and effective management of chronic illnesses like hypertension and diabetes all play crucial roles. In addition to these well-known contributors, less commonly acknowledged factors, including excessive alcohol consumption, tobacco use, depression, chronic insomnia, persistent psychological stress, traumatic brain injuries, strokes, and nutritional deficiencies, have also been shown to hasten memory loss. And of course, medications that interfere with brain chemistry or nutrient absorption can compound those impacts further. While aging and neurodegenerative disease are often cited as the main causes of memory loss, many subtler and often overlooked factors also play an important role. Alcohol and tobacco. Chronic heavy drinking can lead to direct neuronal damage, while nicotine and other chemicals in tobacco impair blood flow to the brain over the long term. Head injuries and contact sports. Traumatic brain injuries, whether from accidental falls, car accidents, or repeated impacts in sports, can result in immediate loss of mental clarity or lead to chronic conditions like CTE, chronic traumatic encephalopathy. Strokes. Even small, undiagnosed silent strokes can damage cognitive networks, resulting in forgetfulness, slowed processing, or loss of mental agility. Sleep troubles. Sleep disorders such as insomnia or sleep apnea directly undermine the consolidation of memory. Our brains rely on restorative sleep cycles to sort and store essential information. High stress levels. Prolonged stress leads to elevated cortisol levels, which can shrink vital brain regions like the hippocampus, central to learning and memory retention. Vitamin B12. Deficiency. This essential nutrient is critical for nerve health and cognitive performance. Deficiency can cause numbness, confusion, and memory gaps, often reversible if caught early. Mental health issues. Depression and anxiety don't just affect mood, They can alter brain chemistry and function in a way that interferes significantly with concentration, memory encoding, and retrieval. All of these factors are preventable or manageable by increasing awareness and taking targeted steps, such as improving sleep quality, reducing stress through mindfulness or therapy, ensuring nutrient adequacy, moderating alcohol intake, and exercising purposefully. It's possible to greatly reduce your risk of memory loss. It's surprising how many medications people take every day, with or without medical advice, that can impair memory, processing speed, or overall brain function. Let's walk through some of the biggest offenders: omeprazole and other proton pump inhibitors, PPIs. Medications like omeprazole, lansoprazole, pantoprazole, and esomeprazole are routinely prescribed or sold over the counter to treat acid reflux, gastritis, ulcers, and similar issues. They work by suppressing gastric acid production, which provides relief from symptoms. However, prolonged use can come with serious drawbacks, not just for digestion but also for brain function. Estimates indicate that patients who continue PPIs for longer than 3 years, such as in a study of approximately 6,000 participants, show higher rates of memory complaints, about 10%. Another study found that roughly 1 in 3 long-term users over 4.5 years exhibited cognitive decline. The likely causes include interference with vitamin B12 absorption, which leads to lower neurological support, as well as disturbances in gut flora, which may indirectly impact brain health. Despite their OTC availability, PPIs should not be treated as casual, over-the-counter remedies. Best practice involves proper diagnosis of conditions like ulcers or GERD, followed by physician-supervised usage, typically limited to anywhere from 2 weeks to 3 months, depending on symptoms and therapeutic strategy. In addition to cognitive concerns, long-term PPI use has been associated with increased risks of nutrient deficiencies, kidney problems, bone fragility, community-acquired pneumonia, clostridioids, difficile infection, and more. This continuous list of potential complications underscores the need for cautious, informed use under medical guidance. Anticholinergic drugs are prescribed for everything from Parkinson's disease symptoms to overactive bladder and motion sickness. They block acetylcholine, an essential neurotransmitter for memory formation, recall, and learning. Though beneficial when used appropriately, anticholinergics are notorious for causing cognitive side effects when used frequently or long-term. A major 10-year study conducted by researchers at the University of Washington confirmed that regular use in seniors increased dementia risk by a remarkable 54%, with greater risk correlated to higher doses and longer duration. Typical medications in this category include scopolamine, meclizine, atropine, benztropine, oxybutynin, trihexyphenidyl, dimenhydrinate, and others. Moreover, the way these medications function by blocking acetylcholine interferes directly with neuron-to-neuron communication, diminishing brain processes tied to memory. Fortunately, not every drug in this family is equally risky. Alternatives like glycopyrrolate, trospium, tolterodine, fesoterodine, tiotropium, and ipratropium, the latter two usually inhaled, have a lower risk of cognitive side effects, though they should still be used judiciously. Given the link between anticholinergics and memory loss, especially in older adults, patients and clinicians should vigilantly assess necessity. Where possible, opt for safer alternatives, use the lowest effective dose, and limit duration of use. In addition to cognitive risks, these drugs often cause dry mouth, constipation, blurred vision, and urinary retention, all of which can reduce quality of life. Corticosteroids, such as prednisone, dexamethasone, and other glucocorticoids, are potent anti-inflammatory medications prescribed for conditions like asthma, autoimmune disorders, and severe allergies. Their therapeutic benefits are well known, but long-term use, especially in oral form, can harm both body and mind. Studies have documented structural brain changes and functional declines linked to chronic corticosteroid therapy. Individuals using these drugs often report symptoms like confusion, disorientation, mood fluctuations, depression, and increased anxiety. One expansive analysis of UK medical records, including over 500,000 patients, found that prolonged corticosteroid use in asthma treatments correlated with a significantly higher rate of memory disorders and dementia diagnoses. Glucocorticoids influence cortisol, and excess cortisol is neurotoxic to parts of the brain like the hippocampus, which plays a central role in memory formation and retrieval. Even inhaled corticosteroids, typically viewed as safer, can have negative cognitive effects when used in high doses over extended periods. Beyond mental and cognitive side effects, corticosteroids also carry serious systemic risks, such as bone loss, osteoporosis, elevated blood pressure, hypertension, blood sugar imbalances, diabetes, and suppressed immunity leading to increased infection risk. To minimize harms, corticosteroid treatment plans should be designed and reevaluated frequently under medical supervision. Patients should be educated about potential side effects and encouraged to taper doses, use topical or inhaled forms when suitable, and explore alternative therapies or lifestyle changes that may reduce the need for long-term steroids. Knowing the psychiatric, neurological, and physiological consequences of corticosteroids empowers patients and providers to weigh treatment options carefully, balancing immediate benefits with long-term cognitive preservation. Many drugs, while effective for treating specific conditions, come with serious cognitive risks that are often under-recognized. The next 5 medications on our list have been linked to memory loss, concentration difficulties, and even increased dementia risk. If you're taking any of these or know someone who is, it's crucial to be informed about their potential long-term effects. Benzodiazepines are a widely prescribed class of drugs used to treat anxiety, insomnia, panic disorders, and even seizures. Some of the most commonly known include alprazolam, diazepam, and lorazepam. While these medications are highly effective in rapidly relieving symptoms of anxiety and promoting sleep, their prolonged use can be seriously detrimental to cognitive health. Extensive research has drawn a direct connection between long-term benzodiazepine use and memory impairment. One striking finding is that individuals who use benzodiazepines for extended periods may double their risk of developing Alzheimer's disease. The suspected mechanism involves both structural and chemical changes in the brain, including permanent damage to neurons and impaired neurotransmitter function. A study reported that more than 40% of long-term benzodiazepine users experience notable neurological symptoms such as trouble focusing, persistent fatigue, heightened nervousness, and even hypersensitivity to sounds, light, or touch. These symptoms may persist or worsen over time if use continues. In addition to memory loss, prolonged benzodiazepine use is associated with sleep disturbances, increased anxiety, especially when withdrawing, muscle pain and weakness, emotional and physical dependence, withdrawal difficulties, and relapse. Perhaps most concerning is the drug's interference with deep sleep and REM cycles, which are essential for memory consolidation. Without adequate sleep quality, the brain struggles to retain and organize new information. Given the wide range of potential harms, healthcare providers are urged to limit benzodiazepine prescriptions to short durations and minimal doses. Safer non-drug alternatives such as cognitive behavioral therapy, CBT, meditation, exercise, and other relaxation techniques can be equally effective in managing anxiety and insomnia without the long-term risks. Educating patients about these risks is critical to protecting brain health across the lifespan. 5. Amphetamines, the memory trap behind enhanced focus. Amphetamines, including well-known medications like Adderall, are commonly prescribed to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy. These stimulants are valued for their ability to boost concentration, reduce hyperactivity, and enhance productivity, especially in academic and high-pressure work settings. However, this short-term cognitive gain may come at a steep long-term cost. Amphetamines function by increasing levels of brain chemicals such as dopamine and norepinephrine, which enhances alertness and focus. But when used for extended periods or in high doses, amphetamines can lead to physical and psychological dependence, insomnia and disrupted sleep irritability, mood swings, and even depression. Memory loss and mental fatigue. Long-term users may notice that their ability to retain and recall information gradually diminishes, even when they're no longer on the medication. Research has shown that chronic high-dose amphetamine use can cause irreversible brain damage, particularly in areas responsible for memory, motivation, and emotional regulation. Reduced cognitive flexibility and loss of motivation are also frequently reported, and these effects may persist after discontinuation. Another grave concern is the high potential for abuse and addiction. Misuse of amphetamines, whether by increasing dosage without medical advice or taking them without a prescription, can lead to life-threatening side effects, including cardiac arrhythmias, digestive complications, sudden cardiac arrest, extreme anxiety or psychosis. To mitigate risks, these medications should always be prescribed and monitored exclusively by qualified healthcare professionals. Patients must be made aware of potential cognitive and psychological side effects and should follow dosage instructions carefully. Behavioral therapy, organizational coaching, and other holistic interventions can provide long-term benefits without compromising mental health. 6. First-generation antihistamines, relief today, cognitive problems tomorrow. First-generation antihistamines such as diphenhydramine, Benadryl, and chlorpheniramine are staples in many households for treating allergy symptoms, colds, and insomnia. While they're effective at blocking histamine, reducing sneezing, itching, and nasal congestion, they also come with powerful anticholinergic effects that disrupt brain function. These drugs don't just block histamine, they also block acetylcholine, a neurotransmitter crucial for learning and memory. Long-term or high-dose use has been associated with short-term memory loss, difficulty concentrating, increased risk of dementia, including Alzheimer's. A comprehensive review of 138 scientific studies found a strong link between regular use of first-generation antihistamines and cognitive disorders. Even more concerning, many people continue to experience memory-related symptoms long after stopping the medication. Elderly patients are particularly at risk, as they are more sensitive to the sedative and anticholinergic effects of these drugs. Additional side effects may include drowsiness and daytime fatigue, dry mouth and blurred vision, impaired coordination or confusion. Fortunately, safer options are available. Second-generation antihistamines such as loratadine, Claritin, and cetirizine, Zyrtec, provide effective allergy relief without the same adverse effects on cognition. These alternatives do not significantly cross the blood-brain barrier, making them better suited for long-term use. Patients should consult a healthcare provider before using any antihistamine regularly. Lifestyle adjustments such as avoiding allergens, using air purifiers, and following anti-inflammatory diets can also reduce reliance on medication and preserve brain health. 7. Tricyclic antidepressants, a cognitive trade-off. Tricyclic antidepressants, TCAs, including amitriptyline and nortriptyline, were among the first-generation drugs developed to treat depression. Although these medications can be effective in managing mood disorders and chronic pain, they come with a range of cognitive side effects. Like some antihistamines, TCAs also have strong anticholinergic properties. They work by increasing serotonin and norepinephrine availability in the brain, but simultaneously block acetylcholine. This dual action can lead to short and long-term memory loss, decreased attention span, cognitive dulling or confusion. Several studies have shown that regular use of TCAs can accelerate cognitive decline, especially in older adults. Memory issues may become apparent within weeks or months of starting the medication, and in some cases, they may worsen with time. Other side effects include dry mouth constipation, weight gain, blurred vision. The elderly are again the most vulnerable population with a higher risk of falls, confusion, and medication interactions. Due to these concerns, many doctors now prefer selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, and sertraline, Zoloft, which are generally considered safer and are not associated with memory impairment. Patients currently using tricyclic antidepressants should not stop abruptly, but instead speak to their healthcare provider about switching to a more modern alternative. Evaluating all risks and benefits before starting any antidepressant is critical for ensuring both emotional and cognitive wellness. 8. Statins, the cholesterol cognition paradox. Statins such as atorvastatin and simvastatin are among the most commonly prescribed medications worldwide, primarily for lowering cholesterol and reducing the risk of heart attacks and strokes. They have undeniable cardiovascular benefits, but concerns are growing over their potential cognitive side effects. While not all users are affected, some patients report short-term memory lapses, difficulty concentrating, mental fog, or confusion. These side effects may be linked to statins' impact on cholesterol production in the brain, where cholesterol is crucial for the formation of synapses and proper neuronal communication. Unlike peripheral cholesterol, which causes vascular damage, brain cholesterol plays a protective and structural role in cognitive function. Research findings on this topic are mixed. Some observational studies suggest statins may help prevent dementia by improving blood flow and reducing inflammation. Others have found associations between long-term use and an increased risk of memory problems. The contradictory evidence could stem from differences in study design, patient demographics, dosage, and duration of treatment. Besides cognitive effects, statins can also cause muscle pain and weakness, digestive issues, fatigue. To address these concerns, patients and physicians should closely monitor any changes in memory or mental clarity after starting a statin. In some cases, switching to a different statin or lowering the dose can resolve the issue. Complementary lifestyle measures such as exercise, plant-based diets, and stress reduction should also be emphasized to help maintain healthy cholesterol levels without excessive pharmaceutical reliance. As we've now explored, many commonly used medications can have unintended and sometimes serious impacts on brain function. From omeprazole and anticholinergics to corticosteroids, benzodiazepines, amphetamines, antihistamines, tricyclic antidepressants, and statins, these drugs may all impair memory or accelerate cognitive decline when used without caution. This isn't to say these medications should never be used, but rather that they must be used wisely. Prolonged, unsupervised, or unnecessary use can do more harm than good, especially when safer alternatives are available. Always consult your healthcare provider before beginning, continuing, or stopping any medication. Informed decisions and personalized treatment plans are the keys to preserving both your physical health and your brain. Thank you for watching and reading. If you found this information helpful, be sure to subscribe, share it with others, and stay tuned for more insights. Wishing you vibrant health, happiness, and lifelong clarity of mind.